Hello and welcome to Health Live at Seniors Today. We have here with us Dr. Rajveer Chinoy once again to talk about arthritis. Those of you who were not there last week, for their benefit, a little about Dr. Chinoy. Dr. Chinoy graduated from the Grant Medical College and did his orthopedic training at the JJ Hospital. And after his MS in orthopedics, he trained at the Children's Orthopaedic Hospital. He went to England in 1983 and worked in various specialized units around the UK for 12 years. He has undertaken arthroscopic knee surgery training in the UK and Singapore, as also a special trauma training in Singapore and Bangkok. His specialties are major trauma, joint replacements, and adult reconstructive orthopedics. Dr. Chinoy is currently attached to the Hinduja Hospital in Mumbai. In fact, he is currently speaking to us from the Hinduja Hospital. Thank you, Dr. Chinoy, for joining us once again this week to speak to us about arthritis. Over to you.
Okay, thank you. A warm welcome to everybody. For those who were there last time, welcome back. And for those who are joining anew today, this is the second part of the arthritis episodes. There's just one correction. I went to England in '83 and came back in '93. Anyway, welcome everyone. Now I'll just go to share screen. Now we're going to go into the inflammatory types of arthritis. And the first thing, and which is common abroad, but also seen commonly in India, and sometimes in India you see a more severe type of rheumatoid arthritis. Now, rheumatoid arthritis is an immune modulated condition, and in this various joints are affected, which I will show you, but funnily enough it has bilateral symmetry. The soft tissues around the joint are actually swollen and inflamed, and that's what causes the problem. And then there's a universal loss of joint space because the cartilage gets eroded, and you get erosions at the margin, and you get weakening of the bone called juxta-articular osteoporosis. And as you have bone loss, you end up with joint deformities. So it involves all the tissues around the bone and then subsequently the joint and the bone. Now, you have a lot of disability early in rheumatoid arthritis because there's inflammation. You get swelling, stiffness, soreness, and warmth. And then the person is weak, gets fatigue. But this is potentially reversible if treatment is instituted efficiently and early. Now, this just gives you an indication of how widespread rheumatoid arthritis can be. It usually starts often in the wrist joints and in the fingers. The feet can often get affected early on, and then later it goes to the shoulders, knees, and into the ankles. This shows how rheumatoid arthritis eats away the joints, and the hips get affected, and it gets involved by the bone softening and the heads traveling inside the joint. And this becomes severely painful, and the person is very stiff and can hardly walk. In rheumatoid arthritis of the shoulder, you get severe soft tissue swelling. The rotator cuff, which moves the arm bone, gets torn. The head gets eroded, and you get irregularities in the adjoining bones. So this is what it ends up looking like, where the bone subluxes upward and stops moving. You can have arthritis in the elbow and you get a swollen bursa, you get a fat pad which is swollen, and you get erosion of the ulna. So everything gets eroded over here. So that's the elbow. And this is a picture of the knees which get worn out and deformed. You can have the whole joint involved with complete space loss, and the kneecap is also involved. There's a lot of swelling around the knee which can be seen in front, and you can see Baker's cyst at the back of the knee, and you can get cysts in the bone also. So rheumatoid arthritis actually is a disease of the lining of the joint. That's called the synovium. While the ordinary osteoarthritis is a disease of the erosion and degeneration of the cartilage. So you do not get shifts of the joint or subluxation in osteoarthritis, but you do get it in rheumatoid arthritis because the soft tissues are eaten away, get lax, and the ligaments and muscles are weakened, and then the joint gets deformities. So the disability in rheumatoid arthritis is the result of the burden of the disease, and people get disabled because they do not control the disease, or the disease does not respond to the treatment, and very often the patient does not comply well as it's a long-standing disease and they don't take their medicines regularly or correctly. So the important thing in rheumatoid arthritis is to control the disease early on. And with modern medication, it's now very easy to get disease control, and surgeons are having to operate less and less these days with lots of new medications now available. The initial medical management is just simple non-steroidal anti-inflammatory tablets, NSAIDs, which are the simple painkillers like diclofenac, brufen, etc. Some patients may need steroids, which can be intra-articular injections or orally given. Then the other mainstay of treatment is DMARDs, which are disease-modified anti-rheumatoid drugs, DMARDs. These are synthetic like methotrexate, hydroxychloroquine, which has now been championed for COVID, and the new drug is leflunomide, and one of the old drugs, which is a good mainstay of treatment, is sulfasalazine. And going back to, I'm still with rheumatoid arthritis, it's important to see a good rheumatologist and get into a balance of drugs so that the swelling is controlled, the pain is controlled, and good physiotherapy and daily exercises keeps your joints mobile. The rheumatologist keeps control on the disease, and the patient themselves has to comply and look after their joint mobilities and flexibilities. Now, this is an odd disease because you can get something similar in little children too, and young children. And it's a similar immune modulated disease, and it's a chronic childhood disease which is commonly seen, and it causes quite a lot of disabilities. It is seen in 7 out of 10,000 newly diagnosed children with juvenile idiopathic arthritis. And there are many subtypes, and the disease begins at any time during childhood or adolescence. Remember, these are diseases to be treated by a specialized rheumatologist. There are various characteristics, and the onset should be in childhood, that is before the age of 16 years, where they should get inflammatory arthritis, and it varies in individuals from time to time, and it's classified into various categories, and these are things recognized by the rheumatologist and treated according to the types. So you can have systemic arthritis, you can have single joint arthritis, you can have those which have rheumatoid factor positive with multiple joints involved, or rheumatoid factor could be negative. You can have enthesitis, which is inflammation related arthritis, or you can have psoriatic arthritis, and sometimes you get undifferentiated arthritis. Remember, these are complex diseases and require concentrated treatment by a rheumatologist. It's very important to do exercises, see that the children are maintained pain-free so they can take part in sports and recreational activities, and they may require splints to give them support and avoid deformities. The important parts of treatment are the stiffness relief, an improved healthy diet, check for eye involvement, see that there's good dental care, and surgery may be required in some of the children. The other important inflammatory disease is gout. Now, this used to be called the rich man's disease or your lordship's problem. And it was known as the disease of kings because the rich foods have a higher concentration of protein, and the products of protein breakdown cause the problem in a person afflicted with gout. So this is seen in those who eat organ meats, lots of wild game, excessive seafood, excessive lentils, peas, asparagus can also cause gouty attacks, as can yeast and beer, though people seem to blame wine and port. These are the important things: meats, game, seafood, lentils, peas, asparagus, yeast, and beer. This mainly is seen to attack the big toe metatarsophalangeal joint, and what happens is urate crystals get deposited in the joint, causing inflammation of the joint, and these urate crystals are like small fine needles. Imagine having multiple fine needles in your eye or in your mouth, how irritating that would be. So it irritates the synovium. The synovium secretes enzymes which cause inflammation and also cause erosion of the bone. And this is severely painful. And this is what they come running with a swollen big toe joint, begging for treatment. So the risk factors are, it's seen predominantly in males. It's more common in males with a ratio of 9 males to 1 female. And usually those females are post-menopausal females. The older males are involved. Those who have hypertension seem to have it more. And those who are on certain diuretics and cyclosporine, they could be affected by it. The risk factors are those in patients who have had a transplant, those who have a high alcohol intake, more so with beer, not so with wine, and those who are obese. It is seen in those with a higher BMI and those with a diet high in meat and seafood. The treatment goals are to rapidly end acute flares because these are severely painful. You have to protect against future flares because this tends to damage the joint. You must reduce the chance of crystal inflammation so as to avoid joint damage, prevent disease progression, take medicines to lower the serum uric acid, to deplete the total body urate by improving its excretion, and correct any metabolic cause with the diet and medication. So, what are the commandments of gout? Hyperuricemia equals gout. It's important to keep the uric acid below the level of 6. You must use prophylaxis for at least 3 months after initiating gout therapy and keep checking for uric acid levels. The patient should not stop the gout medication unless the patient is showing evidence of drugs toxicity or any adverse reaction to the drugs. And it's always important to be in touch with your rheumatologist for continued care of this problem. Now, ankylosing spondylitis is another inflammatory arthritis seen in young people, and it's a chronic, progressive, immune-mediated inflammatory disorder which starts in the sacroiliac joints and then involves slow and continued stiffening of the whole vertebral column so that the person ends up with a bamboo spine and they lose a lot of movements. So the sacroiliac joints are the initially affected joints, and then the spine gets involved. The chronic spinal inflammation is called spondylitis, which leads to the fusion, which is called ankylosing, or they end up with a bamboo spine. So it starts with the involvement of the sacroiliac joints. These are seen on X-rays with sclerosis on both sides. I hope you can see my arrow pointing to the sacroiliac joint. And then you get fusion of the joints of the spine, and it's bilaterally symmetric. It affects the lower third of the spine, and you get a rosary bead appearance with reactive sclerosis and bony stiffening called ankylosis, and you get also weakening of the bone due to lack of movement and bony inflammation, causing loss of bone, hence resulting in osteoporosis. Now, the signs and symptoms that are seen are the axial manifestation. The axial skeleton is the spine. You have chronic low back pain with or without buttock pain. The buttock pain is due to the inflammation of the sacroiliac joints. It occurs mainly at night. The sleep is disturbed and they're very stiff in the morning. They have very limited movement of the back, and often the onset is before the age of 40. So you know, in a young working person, it's a debilitating disease. So as I said before, there's chronic inflammation in the sacroiliac joint, the spine, the chest wall, the rib movements get affected. So when the person takes a deep breath, their chest moves up but not outwards. And often you can have the shoulder and hip involved, and that actually results in inability to stretch upwards, and they tend to bend forward and end up stooped forward, and the hips are kept flexed at night when they're sleeping, and they put a pillow below their knees, and that actually exacerbates the bent deformity formation. I've just got a little to tell you about ankylosing spondylitis, right? Okay, so it exacerbates the deformity and the bending of the person bending forwards, and the hips get flexed. And it generally affects the hip joints and sometimes the knee joints. And the enthesis is the stiff inflammation which happens in the sacroiliac joints. And you get bone formation around the joints of the spine, causing stiffness and ankylosing. That's enough of inflammatory arthritis. Remember, if you get anything of these conditions, chronic back pain, swelling of your joints, it's important to go and see your doctor. And if initial treatment doesn't help, it's important for the doctor to refer you on to a rheumatologist. It's the rheumatologist and you who have to cooperate to control the problem. The orthopedic surgeons like us come into the picture if you have to have any operative surgery for the hands or the wrists, if we have to do arthroscopic synovectomies of the joints to reduce the inflammatory synovium. Sometimes you might need a diagnostic arthroscopy. And if you have severe affection of the knees or the hips in rheumatoid arthritis, you may need surgery. If you have deformities of the hip in ankylosing spondylitis, you may need surgery. And gout, it's important to get hold of it early, diagnose it, treat it, remain in the course of treatment advised, keep your uric acid levels low, modulate your diet, and prevent attacks. Similarly, juvenile rheumatoid, juvenile inflammatory arthritis is something that requires the specialized treatment of a rheumatologist. These days, with all the magic drugs they have, surgeons come in very little and only in those severely affected. I think it's time now, Pradyumna, that we can go to questions.
So we have a question from Shibani Sagar, who asks, is taking steroids advisable in RA, in rheumatoid arthritis?
Yes, as I mentioned, non-steroidals is the first stage of treatment. Steroids only to be used in consultation with your rheumatologist and only for acute exacerbations or those not responding to non-steroidals and DMARDs. Please do not initiate or adjust steroid treatment by yourself. This has to be done in conjunction with a rheumatologist's advice.
We have a question from Mr. N. Ravindranath from Trivandrum. He is aged 74. If we do exercises regularly, can arthritis be reduced?
Sorry?
If we do exercises regularly, can arthritis be reduced, and what duration of exercises?
Now, Mr. Ravindran, if you're talking about osteoarthritis, it's something that we talked about last week. It comes with age. It is not going to reverse, but at whatever age you are, if you have arthritis, osteoarthritis, it's important to control the symptoms in conjunction with your doctor's treatment, but the patient should exercise, remain light, remain flexible, and do stretching and strengthening exercises as their body and age allows. If you have inflammatory arthritis, it's important to keep your joints mobile, flexible, and you should try and keep as fit as possible.
Thank you. We have two questions from Kavita Patkar. Kavita says, I have severe pain in my soles and I'm suffering from osteoporosis also. I'm taking Bioforce 70, very weak.
1 minute. Let's start with the foot pain.
That's right.
Kavita, I think you must be referring to pain under your heels. Now, if the pain is under your heels, then it's known as a condition called plantar fasciitis. The X-rays may show a heel spur. The spur is an anatomical part of the bone. It is not the cause of the pain. It's important to get X-rays done. You get a local ultrasonic done. Correct any foot deformities you have with insoles and seek the treatment of an orthopedic surgeon in your area. If you are overweight, please try and get your weight down. Also take calcium and vitamins and keep those levels up, and plantar fasciitis will settle itself, but a physiotherapist can help, and there are simple foot exercises which can be done to keep your foot active and flexible. Now, the second thing you said, you have osteopenia. Osteopenia is the first part. This can be diagnosed on a bone density test, and the more severe version is osteoporosis. Now, osteopenia and osteoporosis surprisingly are very common in India, even in women before menopause, in young men, and in the older population. And this is a result of not enough exercise, not an adequate diet, not having enough calcium, vitamins, not being physically active. So it's important at an early stage. It's important at an early stage that you find out if your bone is weak, take the necessary steps to treat that, i.e. calcium, vitamins, and bisphosphonates, like Kavita was talking about, all in conjunction with your doctor, and continue the treatment and also do exercises. Again, it's important to remain active, keep your weight to near the ideal weight for your height.
We have a question from Arvind Navare, who says, right hand second finger is slowly opening when I open my hand, and it pains sometime. His age is 68 years.
Right. Okay. Arvind, if can you see my hand moving? Can you see my hand moving?
Yeah, I can see your hand.
Right. Now, when he says second finger, is he talking about the middle finger? Because he's probably talking about a trigger finger when the other fingers open and this one doesn't open. So it gets stuck like this and then opens with a snap. That's called a trigger finger. If he has that, he's got to check himself for diabetes, check for thyroid disorders, and go and see an orthopedic doctor in the locality. He will need some medications and he will need to go to a physiotherapist also.
We have a question from Facebook from Vijay Gupta. Since the last 6 to 7 days, I have pain near the left hand side kneecap. What should I do?
And his age is?
He has not mentioned his age.
Right. Pain in the kneecap region could be related to a strain. It could be related to something called softening of the cartilage called chondromalacia. It could be early arthritis. So in this situation, he goes to his family doctor, takes medications, and does some physiotherapy and exercises. And if it's not settling, then he needs to go to his local orthopedic surgeon, get some x-rays done. He should have views to see the knee as well as the sliced views of the kneecap. So there's x-rays of the knee, AP, lateral, skyline, and tunnel views. But that's if it doesn't settle with the GP's treatment, and then he goes to the orthopedic surgeon for further treatment.
Thank you. We have a question from Brij Gopal Duggal. He's asked this question via Facebook. He says, my wife has L5S1 degenerative listhesis, osteoporosis, DMHTN. She is 70.
Sorry, say that again. What is the last?
DMHTN. Osteoporosis.
Oh, DM and HTN. That's diabetes mellitus and hypertension. Okay.
She is 70. She's undergoing physiotherapy and local SWT, IFT for the last 1 year. The pain has reduced to a bearable level, but has not disappeared totally. Local ortho has ruled out surgery due to old age. She cannot stand in one place for more than 1 minute. Her hands also shake. What is your advice? This is a question from Colonel B.G. Dugal.
Right. First of all, 70 is not old age. Let's start with that. He hasn't told us her weight.
Yeah.
The other thing is, we need, the orthopedic surgeon needs to see the x-rays. He needs to see a fresh MRI if the old MRI is a year or 15 months old. He needs a fresh MRI. He needs to do a bone density. If she's not improving and she gets pain in the lower limbs and the back while standing for a little while, then she might have a condition called as lumbar canal stenosis. That needs to be looked into. If you're not having joy with your local orthopedic surgeon in your area, ask around for a good spine specialist. It's important that the person gets assessed fully, fresh x-rays, bone density, check what her weight is, and get a new MRI if required, and then proceed further.
Thank you, doctor. There's a question from Devendra Gada, and I think he had asked this last time also. Hi, doctor. Fever unknown as chikungunya can be the causes of knee or joint problem.
No, say that again. Unknown fever thought to be chikungunya.
Yeah, fever known as chikungunya, can it be the cause of knee or joint problem?
Oh, okay. A patient who has had chikungunya they can have joint and body pain for months after they've recovered from chikungunya. Now, people have all kinds of Ayurvedic remedies and other things. But what I've found, after you've tried all the papaya juice and what not, what helps is calcium, vitamins, exercises, and a good healthy diet. It's going to take some time to settle. Post-dengue, post-chikungunya, I've seen people with muscular pain, body pain, bone pain, joint pain for months. So just correct your diet, get your activities going, and take plenty of calcium and vitamins, and you'll be better soon.
I have this question from a person who has an interesting handle, C64EDB4B.
Sorry?
His handle is very interesting, C64EDB4B. So let me get to his question. As per MRI, there's an 11 mm gap in the shoulder muscles. I have been doing exercises and not lifting any weight as per doctor's advice for 5 months. It pains when raising the hand. Kindly advise whether 11 mm can be cured with exercise and how long it will take.
Okay. What is the age? Is his age 64?
He has not mentioned his.
Okay.
But I can ask him. 1 second. Let me ask him.
I'm getting the picture here.
All right.
Okay. The gap means you have an 11 millimeter gap in your rotator cuff. This is a torn rotator cuff. Now you haven't specified whether it's 11 millimeters front to back or if there's an 11 millimeter separation between the torn ends.
I think it is separation, sir.
If you have 11 millimeters separation and you have difficulty in lifting your arm, then you need to go and see a shoulder specialist as of yesterday. Let's not talk about it. Go to a shoulder specialist. He will advise you. It's not going to heal itself. Also, if you are a person who has diabetes, you need to get that corrected. And it's important to continue doing your exercises and doing your movements. But if they're painful, go to your shoulder specialist. He can do an arthroscopic repair. And it doesn't matter whether you're 44, 54, 64. Just get it done.
Thank you. Thank you, Doctor. Doctor, we have a question from Jennifer Murray. She says, please advise regarding bend in the spine and sciatica for a person aged 59.
A bend in the spine and sciatica.
Yeah.
Right. Jennifer, please remember that if a person has a slip disc, it bulges out, presses on the nerve, causing the pain which is called colloquially sciatica. It's basically a nerve pain caused by a protruding disc pressing on the nerve. This also causes a spasm in the back, making your muscles unequally into spasm, causing a spinal deformity. So the person seems to be walking a little crooked. This is called sciatic scoliosis or a bend in the spine as a result of a slip disc and sciatica. This person needs to have x-rays. They need to see an orthopedic surgeon or a spine surgeon. If it's not settling, see the orthopod, see the spine surgeon, get an x-ray, get an MRI, get completely examined, and then you can have it dealt with medications, physiotherapy, something called epidural injections, and surgery is absolutely only a last resort if there is no relief or if you get bladder or bowel involvement, i.e. you can't pass urine or you have incontinence.
So we have 3 questions. One is from Jankana Modi, whose age is 63. She says, my right hand middle finger only bent at right angle with both joints of it.
So, is it Jamuna Modi?
Jankana Modi.
Okay, Ms. Modi, I understand this. Now, there's obviously something causing stiffness. You're going to have to see a local orthopedic person or a local hand surgeon in your area, get x-rays of the joint and have it examined. So either there's arthritis in your joints or you have a trigger finger.
We have a question from Sangeeta Kedia, who says, last time you had advised calcium with the combination of vitamins, magnesium and zinc. Kindly share the name of these tablets. Sangeeta ji, I think,
I don't think we can, this is not the forum to share the names of the tablets. Go to your family doctor and ask him for the locally available calcium which has other ingredients in it.
Also, have a look at the video of the last time Dr. Chinoy had discussed some of these things in detail. So
yes, but the one doesn't. I just wanted to say that these are the ingredients which we should be looking for. You know, I did not want to promote the name. I mean, you know, there are many calciums in the market. Some are cheap, some are expensive, some are by good companies, some are by fly-by-night operators. There are all kinds of people manufacturing things, but it should give you 500 milligrams of elemental calcium. It should have about 200 to 400 units, international units of vitamin D, and some daily requirement of magnesium and zinc. Some other more expensive ones will have methylcobalamin, they will have folic acid, and they will have vitamin K27. Now you're looking at price ranges per tablet from simple calcium and vitamin D, a tablet of 2 rupees to 3 rupees, and stretching up to 20 to 23 rupees per tablet for a calcium tablet with all the options. So you can either buy a Maruti calcium or a Mercedes Maybach calcium. It depends on your budget.
All right. Doctor, we have two questions on varicose veins. One is from Katie Dadanchi, who says, Doctor, my husband has varicose veins behind his knees.
No. Let's start again. A little loudly, Pradyumna.
Doctor, my husband has varicose veins behind his knees. Would compression stockings help him? And should they be worn from his ankles up to his groins, and for how many hours daily?
Right. Varicose veins, it's something that it depends on the involvement. If they are only thin spider veins behind the knee, one doesn't know, you know, this is just what she's saying. But we need to see what the varicose veins look like, whether they're thin, thick, bulging, etc. And whether there's involvement of the other main venous system of the leg. So I think it's difficult to answer that. She needs to get to a vascular surgeon or a general surgeon in the area and follow their line of treatment. Stockings can be those which are worn below the knee for varicose veins in the leg, and those you can have stockings which go from the toe all the way up to the groin for varicose veins which involve the whole lower limb. Now somebody from Milan Mehta says, now he's talking about a calcium citrate with, yes, that's the kind of thing what Milan Mehta just showed on the screen, a quick flash. That's the kind of calcium we're looking for. Don't bring brand names into it. Calcium citrate 1000 milligrams will give you an elemental of around 450, 500, and it had vitamin D and zinc and magnesium. That's what you need to go for.
We have another question on varicose veins from Maitri Ashar. She says, I'm 68 and find difficulty in walking due to varicose veins on my feet. Are varicose veins treatable?
No. See, varicose veins start, see, it's the venous system which starts from the top of the foot, goes along the leg all the way up to the thigh. Now, if you need to get examined by your local general surgeon or vascular surgeon. It's difficult to discuss something like this. And varicose veins are usually painless. They may cause swelling of the legs, heaviness of the legs, but they will not cause difficulty in walking. So you need to find out any other cause of the difficulty in walking. Also, you haven't mentioned your height and your weight. So that could add to the problems, and whether you have any other comorbidities.
This is from Shivani Sagar, and I'm sure various other people also want to know what kind of food is advisable for a rheumatoid arthritis patient?
We discussed good foods last time.
That's all.
Those having rheumatoid arthritis, it's important that they take their medications in conjunction with a rheumatologist. That's number one. Number two, whatever foods they're having, they should be healthy, nourishing, fresh foods, and foods which do not cause you to increase weight. It's important to keep your weight down. There's no good food or bad food. Have healthy, nourishing food and have fresh fruits, fresh vegetables, and keep your weight to a normal level.
Thank you. Thank you for your time, Dr. Chinoy, for spending the time from your chamber at the Hinduja Hospital in Mumbai. And it was a delight having you here.
It's an absolute pleasure to be here with you all. I'm happy you enjoyed the talk, or I hope you enjoyed the talk. And thank you for your questions. And at least if you can't go out on a Saturday due to COVID, we can get together on this Zoom webinar kindly hosted by Pradyuman, and we can learn some things.